Sadly, it has earned the title of the suicide capital of the world, and it is here in Ontario today. A new plan is in place to help battle the crisis in Pikangikum First Nations and other Indigenous reservations in the province. Here to talk more about the crisis, Dr. Suzanne Stewart, registered psychologist who also leads the U of T's Center for Indigenous Mental Health and Homelessness. Good morning.
Morning.
Good morning. I mean, this is by far not a new issue, but it just seems now to be coming to light to many, many Canadians.
Well, this is an issue that's both situational and contextual, and that's sadly an outcome from a long and continued history of colonization and federal and provincial policies that have put Indigenous young people into a place where they feel hopeless.
Tell me more about that. Well, let's put it in the case then of Pikangikum. How serious is the situation? Why are we waiting so long before we've actually done something about it?
Well, undoubtedly, it's extremely serious, and it's a crisis. When any person attempts to take their life, it's a cry for help, and it's about feeling isolated, it's about feeling hopeless, it's about not having the resources and support they need to pull themselves out of that place of feeling so lost. The federal and provincial government are making immediate and urgent responses to this, which is good, and that should have been happening all along. But these types of emergency responses haven't been happening because the health of Indigenous people as part of Canada has not been a priority.
So Pikangikum has been in the news, but it is by far not an isolated incident or an isolated community that has these problems. Are we acting enough across the board?
Well, you're right. This isn't an isolated problem. This isn't a new problem. This is something that's been going on for many years. And in some communities, this isn't new. However, it's important to note that there are many communities that don't have suicide problems. And research has been done by psychologists and healthcare providers, and a lot of this research has shown that when Indigenous people have better access to health care, have cultural basis to services, who have autonomy, political and social autonomy in their communities, health problems such as suicide are very small or non-existent. So there's a connection between culture, between colonization, and between health outcomes such as suicide.
So what more needs to be done now? And I'm going to throw in there just education, just simply as Canadians. You know, I didn't learn much about our Indigenous people in school. I educated myself afterwards, and I was blown away and amazed at how they basically won our country for us. If you want to read up on the War of 1812, we might have Donald Trump as a president right now if it had not been for the Indigenous people of this land. Education, that really has to change some minds. But where's it going to come from?
Well, part of the context of this problem is really the profound lack of ignorance of the general population of Canada about who Indigenous people are and what the history of Canada is, and why indigeneity and Indigenous people are important to every person and every political and social situation that happens here in Canada. Because what most people don't understand is that the way Canada was built on the Indian Act, which is still in existence today, with its policies that control and attempt to assimilate Indigenous people, including through the healthcare system and through the education system, is that we've in effect, this country was built on laws that created two groups of people. Those who benefited from the creation of the country through the Indian Act, who are the non-Indigenous people of Canada, and those who were harmed by the Indian Act, who are the Indigenous people. And it's really our responsibility as citizens of Canada to right those wrongs and to create a situation that's not going to lead to crisis outcomes such as suicides of young people.
Yeah. It's almost like we have this argument about who has a right to be here or whatever, but I think the argument needs to be, we all belong to Canada. We all belong to this land, and we need to watch out for each other. We need to take care of each other. And when you hear about more than half of Indigenous children don't even have access to simple medical health that we take for granted that our kids get immediately after birth. So I'm hoping we'll change some minds and change some attitudes, and people will start doing some research, because that's where it starts.
It does.
All right. Thank you very much.
Thank you.